Well, hello everyone. I am Marcia Littlejohn, and I am here at Florida Eye Institute. And oh, I can tell you, and just as they all say, life is looking better already, and truly it is. We're here with a patient of Dr. Karen Todd, who has a wonderful story to tell us. You're going to be meeting Louis, and I want to say this correctly, Louis Lindstadt. Wonderful to see you.
Thank you.
And I understand you're going to have a wonderful story to tell us.
Yes, ma'am.
And it's all because of Dr. Karen Todd. And Dr. Todd, what a delight to see you again.
It's nice to see you too, Marcia. And thank you for allowing us to have this opportunity to talk to the public again about the issues of their health and the importance of regular eye exams. We feel like so many times that we go to health fairs and we talk on television and we do public service announcements and we try to get people to realize it's important for them to come in and have regular eye examinations even if they don't notice a particular problem. But we wanted to give you an example of why this is such a crucial point to give to the public and why it's a beautiful example of how you can get extra days out of your life. And Louis has a wonderful story to tell you, better than we can tell you. So I want to let Louis tell you what happened to him in his life and how he came to be in our office.
Well, it was a little bit woke up, or what do you want to say? I was driving a school bus. I was retired, and took a whole bunch of high school kids up to Sebastian and let them off, and I'm coming back, and I just didn't feel good, and I called my wife and tell her I got some problems with my heart, whatever was going on, and she called and said, oh, well, guess what, you're going for a ride. So I went to the hospital and had a stroke, and a good one, and lost one side of my face, my left side, all the way into my brain, and I was out and didn't know anybody, my kids, everybody on my life. Believe me, it came and I couldn't remember anything. I was gone for probably a year and a half, I guess, across from the hospital, and came back out, and as I was going to go by and check my lights, my eyes and everything, and I ran up with the doctor who was coming up there, and she's looking at me and my eyes, and she says, don't worry about it, just stay with it, stay where you're at, you just keep on going. She said, we're going to make you work. And that was probably the best thing that ever happened to me in my life, believe me.
Was this your introduction to Dr. Karen Todd?
Yes, I stopped her, maybe twice a year or so, and getting your eyes going, having looking and see if you're all right, and yakety-yak. And that's what I just had going, and after I had a stroke, and I stayed with her for, I must be 3 or 4 times that year that she would come in and check my eyes and see if I'm all right, and her words were right over it, just stay with it, get your eyes checked, we'll breathe back on you and we'll get you. And she sure did, let me tell you.
I think this is what is so exciting about this whole story, Dr. Todd, and I think Louis is telling it so beautifully, because you recognize this. What literally do you as a physician, as an ophthalmologist, feel that we should all learn from Louis's experience?
Well, there are several stories. One is Louis had already had an event by the time that he came to see us. And once a patient has an event, we try to help them use the vision that they have if they've had a stroke or some other type of event, macular degeneration, or if it's something that can't be fixed, we try to help them use what's left of their vision through low vision aids or visual training. There are many things that we can fix that when the patient doesn't realize in the last 5 or 10 years that we can do for them, that their father, their mother, their neighbor, oh, well, they told them that we can't do anything about that, so I'm not even going to try. So in Louis's case, he didn't even realize there were so many things that could benefit him that now he lives a full and rich and completely normal life. Isn't that right?
Yes, ma'am. That's the truth.
That's the truth. He can do anything that he wants to do. But that message would have never reached him had he not been a regular patient. Now, the goal really for us is to try to pick up that patient who's having high blood pressure changes in their eye, who has little bleeding, who we say, gee, your blood pressure might be out of control. Let me check your blood pressure. It's running a little high. Have you seen your regular doctor? Did you take your blood pressure medicine this morning? So we frequently find the patient who has hypertension changes or who has diabetic changes who doesn't realize that they're right on the edge of having a problem, and we want to intervene before they have the stroke.
So this is really one of the key points that you're trying to get out right now in this particular segment,
Right.
is that yearly exam is so important. And if you have a little tiny bit of a problem, come and see you, because you can, in many cases, catch it before even it happens. Isn't that true?
Correct.
All right, so this is a happy story.
It is.
All right. So now, what would you say to all of our viewers out there that may be thinking, "Oh, my eyesight's fine. I can, I'm okay."
You won't believe what happens until you go out and have them checked all the time. Because if you don't, you're not going to be able to see anything. I can.
I know it's hypothetical, but there is a good chance that if you had been coming regularly, you could have maybe identified something in someone who may be getting ready to have a stroke?
We frequently see hypertension changes, or we see little cholesterol plaques in the arteries that have come from the carotid arteries. We can see those in the arteries in the eye, and we will frequently send them out to the vascular surgeons, and the patient can be evaluated for carotid endarterectomy. Or we see little clots that have broken off from the heart in patients that have atrial fibrillation. So we do see small little changes in the eye before they have a big change in the brain. So yes, it is very important for people to have.
Do you know what I hear you saying, Dr. Karen Todd from Florida Eye Institute? Eyes have a great importance in determining some of the other activities that are going on in your body.
That's right. People say the eyes are a window to the soul, but that's the poet. The doctor says the eye is the window to the rest of the body.
I love it. Oh, this is what you gain when you come to Florida Eye Institute, and I think with Dr. Karen Todd here, and of course her very lucky and very, very happy patient, Louis Lindstadt. And once again, tell all of those viewers out there how important it is to have that yearly exam.
It is what happens. You got to do it. You got to do it. If you don't, I was lucky. I had the good Lord on my side, and and my lady over here, I'll tell you, she owes me, I owe her a whole bunch, or one or the other.
I said, really, Dr. Todd owns you now, right?
That's for sure. That's for sure.
Well, I think what we have learned here at Florida Eye Institute is that you do indeed need to have that regular eye appointment. And Dr. Todd, it's been wonderful talking with you again.
It's good to see you again, Marcia.
Wonderful things that you're doing for people. And Louis, congratulations. And we're going to keep right up with you, okay? And make sure you're right in here all the time, as every single one of you out should do. Make that appointment today. Florida Eye Institute, right here in the Vero Beach area. And of course, people come from all over the world to meet some of these doctors here. So we hope you've enjoyed this particular segment. Thanks,
Thank
Karen,
you.
Thank
and
you.
of course, Louis.
Thank you, Marcia, and thank you,
we'll be
Louis.
back. Stay with us. Welcome back, everyone. We are so thrilled to be once again at Florida Eye Institute, and I am here with three absolutely wonderful ladies, and they have a story to tell. First of all, I want to welcome Donna Mansfield, because you are the lady we're going to be talking about. I hope you're doing okay.
I'm doing great, thank you.
Well, it's wonderful to have you here, and I'm going to have Dr. Karen Todd of Florida Eye Institute introduce this young lady that is with you, because you said really she's the hero in this group.
That's right. I wanted to talk a little bit today about why it's important to follow up with regular eye exams, and also why it's important not to ignore symptoms in your vision that you may think are not really important. And we're going to talk today about Donna Mansfield's emergency visit to the Eye Institute and how she happened to encounter Anna Lee. And really and truly, Anna Lee is the star of this segment. So Anna Lee, tell us a little bit about your first encounter with Donna Mansfield.
Well, Miss Mansfield came in with symptoms that
of headaches, dizziness, and episode where she lost her vision for a couple seconds, couple minutes. But she came in kind of brushing off the symptoms, and she thought it was because she was getting old, she was stressed. And I said, no, I have to pull Dr. Todd aside and see if she wants to add on some testing. And that's what I did, and Dr. Todd agreed with me that, we'd had to investigate her further. And that's how I helped Dr. Todd find out that it wasn't just stress or old age.
As I thought.
Yeah.
Donna, let me just ask you a question, though, because what was going on in your mind? What did you really feel when you were talking with Annalee?
It's just another eye exam. I really didn't give it much thought. But in the middle of the exam, she stopped and went and got Dr. Todd. And it made me think there's something else going on. And if she didn't recognize that, I never would have either.
I think this is what we're all trying to point out, that when you have professionals such as yourselves and you come in and you don't miss that yearly exam that you should be coming into. So what did you discover, Dr. Todd, and what was your reaction as well after Annalee brought you into the scene?
Well, the reason that Donna was not concerned was that her vision is actually 20/25. So she's only a half a line off of 20/20. So when she looked out at the world or looked at the television, she could see well. And what the testing that Annalee thought that Donna needed was a peripheral vision test. And what it showed was that Donna had had a small stroke in the occipital lobe. And so the emergency test that was ordered that day was an emergency MRI and emergency MR angiogram. And Donna can tell you what that showed.
I had a brain aneurysm, 7 millimeters in size.
Oh.
And I was informed that after 5 they could burst. So these women here saved my life. An eye exam saved my life, and I'm able to be a grandmother, which is the greatest thing. If I didn't come in for my exam, I don't know where I would be right now.
Oh, bless your
It
heart.
is wonderful. It's a new outlook on life. I wake up every day and see my grandchildren because of an eye exam, so I thank you two very, very much.
Do you know,
you really did.
We hear these stories about Florida Eye Institute so frequently as well, and I guess this is one of the things that makes your job and your profession really worth everything, isn't it, Dr. Todd?
Yes, it really is. In fact, Annalee will tell you, when we start in the morning, I remind the technicians, if we can only help one person today, if the Lord will just bring one person into our office that we can make a difference, it'll make the day worth it. And Donna was our person that day. And sometimes we don't even know who that person is. I mean, we may help somebody, and it may not be known to us that day who it was. But the day that Donna was there, we knew, and we were able to help her get it fixed. And you could see that her hair is even growing back.
You said you were very proud of that scar.
I am. It starts up here and goes all the way down to here. And that's my battle wound for life, but I'm trucking on because of these women here. I get to keep going.
So that was an emergency call that you made right at that particular point in time. I really want all of our viewers, though, to understand that, because I think a lot of people are going to be thinking out there, that was just luck. That was luck. It isn't. It's that regular appointment and, of course, a lot of faith as well. But that's the importance of having these appointments. Is that right?
There is so much they can see through your eyes that I didn't even know until now. You need your appointments. You don't know what's going on in there, and they can tell.
And don't take the chance and say you're just getting old, right?
No, I made that mistake. Oh, I'm old. Oh, it's stress, whatever. I wear glasses. And I took it as just another visit. Yet literally it saved me.
So, Karen, what I'd love for you to do is take these last 2 minutes, really, and Annalee, you as well, join in. Tell our viewers, if you will, all of the patients, of course, here at Florida Eye Institute, all of the individuals around that may have a little concern about their eyes, but what is it that we should be looking for? When is it important to get in and have that regular eye exam?
Well, we recommend an eye exam every 5 years under age 40, every 2 years from 40 to 65, and then every year after the age of 65. That's what the American Academy of Ophthalmology recommends. And that's because so many diseases truly are asymptomatic. Macular degeneration, it can be caught in early stages, and there's good therapy now. Diabetics, cataracts are obviously very common. People just need their glasses changed. But occasionally you will find something serious and life-threatening. The other thing that is very important to realize with Donna's symptoms is we all don't want something to be wrong. And it's so easy to discount the symptoms and say, you know what, it really didn't happen. My headache wasn't really that bad. My vision didn't really go out for that long. And then you really do have a problem when it comes back. So you want to intervene before the patient has a major episode. And that's what we were able to do with Donna because she came in. And we do try to bring people in with a problem anytime they need to be seen.
And it's not just the individual. I am able to be a grandmother and help my grandchildren. So it's my whole family's life that has been changed and affected, not just me personally. And I'm a teacher, so it's my students' lives.
Yes.
It's not just me you helped. You helped everybody that's involved in my life.
That's what makes this job so
And it's
rewarding.
so important to get your eyes examined. I can't say it and stress it enough. I am able to be who I am because of an eye exam.
Do you know, this is what I love to hear you say, because of an eye exam, and it's that regular eye exam.
It is. You take
And
it for granted.
And what about just when you have that first little feeling, because I was reading some of the description as to what you went through, and you were going to just let it go.
I did. I let it go. Oh, it was a headache. I'm a teacher. Oh, maybe I was under stress. I'm getting older. No big deal. Don't worry about it. You make up excuses. You don't want to know. You just want to go. You're busy with your life and you go.
But Anna Lou knew that there was something wrong.
She did, right?
Yes.
In the middle
No
of the
one
exam.
in America comes in and says, I'm not having stress. No one. If you ask every single person, they all say I'm having stress. So it's not stress.
she recognized it.
But she knew that there was something wrong and came to find me.
And you know what I want to say? And that is what is all about here at Florida Eye Institute. Every single one of these young ladies out here, they're all trained, they're all working with all of you physicians that are so top-notch. And that's why I think a lot of people's lives have been saved and changed. Is that right?
Oh, it sure has. I wake up to sunshine every day now.
Oh, boy.
I truly do.
Well, I think all of us are going to be waking up to sunshine now that we've heard these wonderful stories. I want to thank all of you for being with us here. It's so much fun to be right here in the office of Dr. Karen Todd, actually in one of your, what do we call this, examining rooms?
Right.
I feel so medical at Florida Eye Institute, and I love what they say. Life is looking better already, and it
It
can
sure
for
is.
you as well. We'll be back. Stay with us.